I think for the core Sigma business, we feel like the COVID-19 situation has probably assisted our financial result on the way through. Um, Pharmacy is a relatively stable business, so we haven't been as impacted as other business in terms of what our core operations. And we've also had the added bonus of a little bit of a pickup from PP&E sales in some of our businesses as well.
Now, you've been pretty solid when it does come to your cost out program. You've hit around about 86.8 million of that $100 million target. A lot of that was also driven by the fact that you've also sold down those distribution centres. You've got 2 more. Are you looking at perhaps moving forward, selling those off as well and leasing them back?
Yeah, I guess just to clarify, the cost out program, which we call Project Pivot, was originally set up to identify $100 million of cost efficiencies. We've got $87 million of those savings to date. We made the comment today we've managed to realise another $4 or $5 million of those savings in the period since the end of the half year, so we're very confident about trying to get that cost base down. In terms of the sale and leaseback arrangements, which are separate to that, yes, we've completely sold down 2 of our DCs where we bought the land and buildings. There's another 2 that we have available to us to use for future transactions like that if we want, but there's no plans to do that at the moment.
Now, I've got to touch on the Victorian lockdowns. You're obviously based in Melbourne. From, I suppose, not just the business standpoint, your views on that, but also from a personal standpoint, what do you make of the further restrictions being imposed by the Andrews government?
Look, I think like a lot of Victorians, I was probably hoping that we would see an earlier way out of where we've been for the past sort of 6 weeks in particular. I do get it's difficult to balance the sort of healthcare objectives and the economic outcomes that that choice that the government inevitably faces. From a business perspective, because we've set ourselves up to operate within effectively the confines of what we've seen in the last 6 weeks, we're fine. I do hope that we see continued improvement in the COVID cases in Victoria, so hopefully the government can review the approach we've taken, because I think the novelty's starting to wear thin at the moment for a lot of people.